Hello everyone. Let's discuss contraception today. Contraception are methods or devices that prevent an unwanted pregnancy. They differ in terms of their mechanism of action, effectiveness, and considerations. So, I'm going to discuss what are the common methods of contraceptions and devices available in the market, how to choose them, and what are its advantages and disadvantages. Some of the most common contraceptive methods are first and foremost the barrier methods. These are the male condoms and the female condoms. Male condoms are sheaths which are worn on the penis, while female condoms are sheaths which are inserted inside the vagina. They prevent the sperm from ascending into the uterus. Additionally, they are effective in preventing sexually transmitted infections. The thing about barrier methods are they need to be taken consistently and especially before every act of intercourse or coitus to prevent a pregnancy. Other examples of barrier methods are diaphragms and cervical caps. These are small dome-shaped devices which are inserted inside the cervix and they prevent the sperm from entering the uterus. The next common method of contraception are hormonal methods, most commonly the oral contraceptive pills. The oral contraceptive pills are hormonally active pills which have to be taken on a daily basis during a period cycle to prevent a pregnancy. The mechanism of action involves preventing ovulation and thus preventing a pregnancy. They are one of the most effective methods of contraception when used consistently and appropriately. Apart from oral contraceptive methods, pills, there are also oral contraceptive patches which are applied on the skin and which release the hormone at regular and continuous basis. Additionally, there are also injections available which have to be taken monthly or 2 monthly and they all act the same way by preventing ovulation. Next common method of contraception are the long-acting reversible contraceptive or the LARC methods. Most common among them are the intrauterine devices. These are small T-shaped devices which are inserted inside the uterus and they prevent implantation or ovulation depending on what they contain. So these devices can be hormonal, which contain hormones, or non-hormonal, which commonly contain the copper or the copper T devices. They are inserted inside the uterus and they remain there for a long period of time. The most important thing about this type of contraception is that they are very effective, they have very low failure rates, and fertility resumes as soon as they are removed from the body. Another kind are also the implants. These are hormonal implants which are inserted on the forearm of the woman and they release hormones at a constant regular interval, preventing ovulation and thus contraception. Next, we can discuss are the natural fertility awareness methods. These are methods which are commonly used by many couples. What are these? So as we are aware that pregnancy happens only around the time of ovulation, so you tend to avoid intercourse or coitus during and around the time of ovulation. Additionally or alternatively, you can also use a barrier method around that time to prevent a pregnancy. The problem with this method is that it has a very high failure rate. Any miscalculation or a menstrual irregularity can cause a failure. Next, let's discuss permanent sterilization methods. These are surgical procedures which are vasectomy for the male and tubal ligation for the female, which prevent a pregnancy. They are called permanent as they are not easy to reverse. Last and not the least are the emergency contraceptive pills. These are also known as morning after pills. They are to be taken after any act of unprotected intercourse or if a contraceptive method or device fails. They are to be taken as soon as possible to be effective. However, this method has lots of side effects and they should only be taken under medical supervision. Now, how should you choose your contraceptive method? We should look at their effectiveness, and how effective that particular method is in preventing a pregnancy. Accessibility and convenience. Is it accessible for you to go buy them or use them, and convenient for you? Third, any health interactions. So maybe you're not well, you are on some medications, and some of these medications may not work with some of the contraceptive methods. Additionally, prevention of sexually transmitted infection should always be on priority. So, for an individual to decide on a contraceptive method, we should always go and discuss it with a healthcare provider to help them understand your health, lifestyle, and reproductive goals. Accurate information and understanding of the mechanism of action will empower you to make the right decision regarding your sexual health and family planning. Thank you.